So, one of the questions that comes up a lot is what happens during the infertility process? So, this video is just to briefly describe the IUI process.
The process. An IUI is what I refer to as level 2 treatment, or the cocaine of infertility treatment, if you will. Level 2 is a bit harsher than level 1, timed intercourse with medications. But not yet all in, like IVF, the fertility equivalent to mainlining heroin. The process always begins on cycle day 1 with a call to the RE. They will set up the appointment for the first follicle scan and direct you when to start your medications. For me, that usually means Gonal-F, an injectable medication, beginning on cycle day 3, with my first follicle check around cycle day 7. A follicle check is done to view the ovaries and determine the size and number of follicles. Follicles contain eggs. If too many large follicles are visible, they will cancel treatment for the month due to overstimulation. This helps to prevent women from having a litter and ending up like Octomom, because no one really wants to do softcore porn to support 8 kids, and I, for one, have only put away enough money for a mommy nip and tuck makeover, not a complete teardown and rebuild that 5 or 6 babies at a time would cause. The follicle check begins at the lab, where blood is taken to check various hormone levels and some other bullshit that I have no idea. The point is, they're making sure your body is producing correctly and to predict ovulation. Once the blood work is done, I leave for the RE office, where the follicle check is done. The follicle scans themselves are done using a transvaginal ultrasound to view and measure the large follicles in each ovary, and to also measure the lining. Later in the day, after reviewing lab work and comparing to the follicle size, they will call to make medication adjustments if needed, and to schedule an additional check. On average, I have about 3 follicle checks done, one every few days or so, until hormone levels and follicle size are both good. Generally, they like 1 to 5-ish follicles, to each be about 18 to 22 millimeters, and blood work to have the correct hormone levels. Following my Wednesday follicle check, I was called and told to trigger Friday night for a Monday IUI. A trigger shot is a shot used to force an egg to mature and your body to ovulate, usually within 36 to 48 hours of taking the trigger shot. The trigger does this by introducing a shit ton of pregnancy hormone into your system. For this reason, an individual will test positive for about a week or so following their trigger shot, and may also become batshit crazy, more so than the normal 2-week wait. For example, I once became teary-eyed because at work we couldn't figure out where we wanted to have lunch. Granted, I was laughing while tearing up because I fully understood how batshit fucking crazy it was. But, just so you know, it can make you crazy. Once the date for the IUI is set, a call to the lab is made. This is a private fertility lab located about 20 minutes from post. The lab will schedule a time for the sperm wash, which is a process in which individual sperm are separated from the fluid in semen. The lab will ask if you're going to be using fresh or frozen semen. These questions become your life and at some point become normal questions. This is your life now. The morning of the IUI, I go to the lab to pick up my sperm, if it is a frozen sample, or my husband will come to create a fresh sample, and you're all big enough to figure out what that means. Usually there are a few couples in the waiting room, and since sperm storage and spinning is the only thing this particular lab does, it can be a bit surreal. This is due mostly to the fact that it is one of the few times you can be 100% certain that every guy in the room has just or is about to masturbate. Bet you never thought masturbating could lead to pregnancy. Once washed, a woman will give you an envelope and it has information about the sperm in it, and she will hand you a small vial and then tell you to place it in a warm location and keep it upright. They suggest your bra. The irony is not lost on me here, since for years sperms ended up near your tits in an effort to prevent pregnancy. A drive to the doctor's office, where the procedure is done, in this instance, at Womack. 2 women place a speculum without lubricant, then a catheter is inserted into the cervix. Sometimes they'll also conduct an abdominal ultrasound to ensure that the catheter placement is correct. Lubricant is used for this. Then, the sperm is injected, the women leave the room, and you stay with your feet essentially in the air for about 15 minutes. So, to recap, to make a baby, simply make your husband masturbate, put sperm by your boobs, let 2 women place a catheter without lubricant, and inject sperm into you. Clean lube from stomach, lay down for 20 minutes. Up next is the 2-week wait. This is the magical time during every infertile woman's 2-week wait, where she will second guess and overanalyze every cramp, twinge, and strange feeling, followed by an obsessive Google search for early pregnancy symptoms. Enjoy!